So let us say you're more than age 40 and you've been having knee pain. You got an MRI and in the report it says that you have a meniscal tear and you're confused on what to do next. So in this video, I'm going to discuss what is meniscus, the meniscal function, and why we advise surgery on only a certain percentage of patients and the rest of the patients actually do well with physical therapy. So let us talk about a fact here. So around 25% of people will have a meniscus lesion on the MRI between the age 50 to 59. Around 35% around the age 60 to 69. And around 45% will have a meniscus lesion between age 70 to 79. And let us say this patient also has knee arthritis, then it's almost going to be 75 to 95%. So just because the MRI shows a meniscal tear, it doesn't mean that is what is causing your symptoms. But still, you have a tear. Why not fix it, right? That's how we think, right? Let's say if my fridge is broken, I want to fix it. Let's say if my microwave is broken, I want to fix it. But that's why you have to understand what is meniscus, its function, and what are the treatment options for meniscal tear. So there are two meniscus, medial and lateral. So basically they lie in between the bones, and the function of the meniscus is to basically dissipate the joint forces. So think about throwing a stone in the water and you see the ripple. That's exactly what the meniscus does. It dissipates the joint forces. So the meniscus is made up of fiber, and they are like any other structure in the body like bone and muscle. So they need the nutrition to function, and the nutrition comes from the blood supply. So for easy understanding, I'm going to divide the meniscal tear into three types, okay? So let us assume that this is the meniscus, and it's like right here. So I'm taking the meniscus off, and this is a C-shaped structure. And think about, let's assume that these are all fibers, and these fibers have the property to dissipate the joint forces. So the first tear that I'm going to talk about is called as a peripheral, a longitudinal tear. So basically what I mean by that is that, so let us say I take a knife and I just put right? It goes all the way. So this is a tear. And this part of the meniscus has a good blood supply. And also that, so let us say if you have a tear and then the tear is like flipped this way, this can cause a lot of mechanical symptoms, and basically that part of the meniscus is not functioning. So which means that the joint forces are not being dissipated. So it makes sense to sew this back together and then should be fine, right? The other type of tear that we see is called as a root tear. So this part of the meniscus here, so let us say this part here is attached to the bone, this part here is attached to the bone. So let us say one part comes off, and this is what we call as a root tear, then it makes sense to suture this root back to the bone, and thereby the meniscus can do its job. The third type of tear is what we call as an irreparable type. So basically these are all like degenerative tears. So let us say I take a knife and I just put a slice here, I'll put a slice here, I'll put a slice here, I'll put a slice here, maybe break this way. So these are all irreparable tears. And what happens is that, so we cannot fix this tear, right? The only thing that we can do is that, let us say if this particular, let's say this part of the meniscus is completely lot of like unstable tears here, then they can just cut off this meniscus part and then just throw it away, and then you only have like 75% of the meniscus remaining. The problem is that by doing so, right, you increase the risk of arthritis significantly. I'm not talking about just slight increased risk. I'm talking about developing arthritis even within 2 years. That's how important the function of the meniscus. Unfortunately, as we age, the meniscus loses its function too. So how do I usually treat these patients? So first thing I do is a proper clinical exam to find out if the pain is coming from the meniscal tear or if that tear was an incidental finding. It's all about treating the patient and not the MRI. So next I get an X-ray to rule out knee arthritis. If the patient has arthritis, then the treatment is focused on arthritis rather than the meniscus, unless this person has a root tear of the meniscus. So let us say I determine that the patient's knee pain is actually coming from the meniscal tear. Then what I do is that I provide them a course of rest. I'll start them on physical therapy to focus on knee strengthening, hip and core strengthening exercises, and then slowly transition to the activities that they love. And let us say if the knee is still inflamed, then I would consider discussing about cortisone injection. So this was illustrated in a study published in the New England Journal of Medicine in 2013. The study consisted of two groups. So one that underwent arthroscopic partial removal of the meniscus. So basically they removed the irritated meniscus. And the other that underwent fake surgery. So basically they still had a surgery, but then the meniscus was not touched. but then this group actually also had physical therapy. So both groups were doing better at 2 years. The group that received physical therapy also showed improved muscle strength after 3 months. However, all of the patients in the study had irreparable tears of the meniscus and not the root tear or the bucket handle tear that we talked about. I hope this video clarified what it means when you see a meniscal tear in MRI. So it's important to make sure that you discuss with the doctor to find the right treatment option for your knee pain. And then if this video is helpful, please post in the comments below and